Good morning. I'm Scott Wright and I serve as the City Manager of Decatur, and I'd like to talk to you a little bit more this morning about the Governor's Restore Illinois plan and what it means for Decatur and Macon County. As some of you know, if you've been following the press reports, we are currently under Phase 2 for this central region of Illinois. Under the Governor's Restore Illinois plan, the soonest that we could move to Phase 3 is May 29, and the soonest that we could move to Phase 4 is likely around June 26th. Now, if you're like me, then you're concerned that those dates are too far out there and it doesn't allow the flexibility for local businesses to return to some form of business recovery as soon as possible. So let me tell you a little bit about how each of us can help get the economy moving and try to accelerate those phases, because the sooner we move to the next phase, each phase as we move to it has greater flexibility, greater openness for local businesses and other sorts of commercial activity to resume. So all of us want to do that, but our efforts have to be tempered by the desire and the intent to make sure that we maintain public health. So what we can do really falls under two categories. The first is we need to drive down the percentage of positives as a percentage of the total tests. And there's two ways that we can do that involve the citizens, not just healthcare providers and local government. The first is the use of these masks. Now, at this time, the city is not supplying masks. However, you need to know that there are several businesses that do supply them, both medical supply businesses and general retailers here in Decatur. Now, a local business may require for entry into their business that you have a mask. It doesn't have to be a fancy surgical mask. It can be a homemade one like this, even some without stitching. These are easy to make. And the ones that are available in the stores here are usually available for less than $1. If a business provides the mask, that's fine for entry into their business, but no business is required to give you a mask in order to allow you entrance to the building. The second thing is testing. And the governor has made it a priority to try to get to at least 10,000 tests every day. In fact, over the weekend, he was able to get to the 20,000 in one day. Now, the more tests that are performed, the more positives there are as well. But if everybody has access to testing when they want it, when they need it, then the number of people who are negatives are probably going to increase as a percentage of those who are positives, and that's what we want to see. So medical providers here in Decatur have made general testing available much more easily than in the early days of the pandemic when we had fewer test kits available. Now those test kits are more readily available, and healthcare providers are more readily set up to administer them to those who want them. Because our two local hospitals are primarily focusing on testing their patients who are entering the hospital for other things, whether it's COVID or other sorts of medical procedures, we're directing folks who want to have tests who are not going into the hospital for some other reason to Crossing Healthcare. So if you want to have a test, then you want to look to Crossing. So in summary, the first thing that we need to do is wear the masks, practice social distancing, and if you need a test, then call Crossing Healthcare. The second thing that we can do is, within the guideline provided by the Governor's Restore Illinois plan, is to, if you can say it, maybe push the envelope a little bit about what the language requires for each of those phases. With each phase, as I said, there's a little bit more flexibility for businesses. Now, it doesn't answer the question of everything, of all types of businesses. It doesn't answer the question of how to provide at-door sales. It doesn't answer the question of how you might provide a retailer the option and flexibility to do by appointment visits only, one at a time. And that would likely be in Phase 3. Phase 2 allows for general health care to resume, but some people question whether or not dentistry is allowed for that. It is, and as a consequence, the Illinois Department of Public Health has issued guidelines for dentistry. Nevertheless, within each of these phases, there's a little bit of room for us to interpret it locally as to how that rule or that guidance would apply here in Decatur and Macon County. And so local leaders are trying to come up with those rules so that we can take as much advantage as possible of what the guidelines are in Phase 2, Phase 3, Phase 4, respectively. I can assure you that the mayor and council are anxious to return to some sense of business normalcy and normal commercial activity as quickly as we can within those three phases. And there is room to give local interpretation to those, and we will provide that information as soon as it's available. So we thank you for your participation, for your support, for your reminding your neighbors to wear masks and to practice social distancing. And we appreciate as well the calls and inquiries and emails that we've received from businesses and others asking us for some of the guidance in these areas. And but please know we'll get through this together because we're working on it together.
Hello, my name is Emily. I'm a health educator at the Macon County Health Department. Today I'm going to talk to you about stress during an outbreak. COVID-19 may be causing a lot of stress, fear, and anxiety for some people. This can be overwhelming and cause strong emotions in both children and adults. Stress during an infectious disease outbreak could include fear and worrying about your own health, the health of loved ones, changes in your sleeping or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, worsening in mental health conditions, and also an increased use of alcohol, tobacco, and other drugs. We have to remember, everyone reacts differently in stressful situations. How someone responds could be based off their background, the trauma they've been through, and the community that they live in. Taking care of yourself, your friends, and your family can help you cope with stress. Helping others cope with stress can also make our community stronger. Some things that you can do to cope with stress is to take breaks from social media, limit hearing or reading about the pandemic. When you are hearing or reading about the pandemic repeatedly, this can be upsetting. We also need to take care of our bodies by taking deep breaths, stretching, or meditating. Try to eat healthy, well-balanced meals, exercise, get plenty of sleep, and also avoid alcohol, tobacco, and other drugs. We also need to take time to unwind and do something that we really enjoy. Be sure that you are connecting with people that you feel comfortable with and you're able to share your thoughts and feelings. We also need to remember to take care of our mental health. If you are needing support, make sure you are contacting your healthcare provider when needed. Also, those with pre-existing conditions should continue their treatment plan. Now, for our parents and caregivers, children and teens react based partially on what they see from the adults around them. When you feel confident, calm, and knowledgeable about what's going on around us, you can provide better support for your children. Just like adults, children and teens react in many different ways in stressful situations. Some common changes that you can watch for in your children are excessive crying or irritation in younger children, reverting back to old behaviors such as bedwetting or having toileting accidents, also excessive worry or sadness, unhealthy eating or sleeping habits, and irritability or acting out behaviors in your teens, poor school performance, poor concentration, and unexplained headaches and body pain, use of alcohol, tobacco, and other drugs. Some ways that you can support your children and teens are to talk to them about the COVID-19 outbreak. Really listen to what they have to say and what they're asking you. Provide them with facts so that way they can better understand what's going on around us. Reassure your children and teens that they are safe and let them know that it is okay to be upset. Share with them how you deal with stress so that way they can learn from you how to cope. Also, limit your family's exposure to news and coverage on the pandemic. Try to keep up with regular routines. And lastly, be a good role model for them. By taking breaks, eating well, and exercising, these are showing them some really good habits that they can also take on. Coping with stress will make you, the people you care about, in our community stronger. So if you need to learn more about coping with stress during an outbreak, please visit the CDC's website. Thank you.